Hi, I'm Elizabeth Hess. I'm here with Julie Pryde. She's the administrator of the Champaign-Urbana Public Health District. Julie, I know that we are not trending in the right direction right now. Only 2 states are. Where are we in Champaign County and the surrounding area?
Okay, well, right now, as of yesterday, or as of this morning, I'm sorry, we have 337 active cases. So those are individuals in isolation. We have 1,145 individuals in quarantine. If they're in quarantine, that means they must stay in their homes without being around other people for 14 days. We have a total cumulative of 5,655 cases since this began. Our region has done an astonishing 690,000, over 690,000 tests. We have currently 5 people who are hospitalized, and we have had 28 deaths. What's really concerning right now is that our entire region, so Region 6, which is 21 counties, even though they included Champaign County's testing data in there, which definitely helped the region buy some time. Apparently, it's not buying a lot of time because we're now up to 7.6% positivity in our region. Once you get to 8% positivity for 3 days in a row, that means our entire region, all 21 counties, will be moving into the mitigation phase, which means things will be closed at different hours. Things will be shut down, some things, smaller capacity limits. So we're not trending in the right direction. And even though Champaign-Urbana is doing a good job, and the county is doing a good job, we are in the entire region. So, and I can tell you right now, I looked this morning and we have some, around us, DeWitt County, high positivity, Vermilion County, high positivity. But really concerning is Crawford County down in the bottom of ours. They have 26.6% positivity rate. That is super high.
And
That
I'm
means for
assuming
every 10 people they, test, they're going to find 26% of those to be positive. That is a lot of people.
we have great facilities here in Champaign-Urbana, but I'm assuming in other more rural parts of the district, there isn't such great access to healthcare. Is that
Correct.
true?
That is, and that is something that, unfortunately, places aren't really thinking this through. There's a lot of counties that really have extremely low healthcare capacity, and you have to go a long way to get to a hospital, or to an emergency room, or even to a physician sometimes, and they don't have the access, and yet their numbers keep going up. And these tend to be the places that are least likely to be doing the mitigation efforts that we all have to do, the masking, the hand washing, and the distancing, and those are going to be critical. We're in for a rough 2 months right now. I can tell you that right now. If not so much Champaign County, definitely our region. And I hope the people in Champaign County continue doing what they're doing, because it is very helpful.
To be clear, this region has not reported influenza A yet. Is that correct?
Correct. Not, I mean, to my knowledge, we haven't. I could look. Something might have happened, this weekend, but no, its flu is not here yet. But it's coming. And again, I'm beyond proud of our community for the high numbers of people who have already gone out and got flu shots. That's going to help us a lot and help protect our healthcare system.
I'm going to give you some numbers now. The nation's averaging more than 53,000 new cases per day. At least 26 states reported more than 1,000 new infections in a day this week. Have you found that people don't really get the severity of this until it affects them personally, until they know somebody that has it?
Well, certainly that is the case for some people, unfortunately. I mean, we just saw the example of Chris Christie, who had it and was in the ICU for 7 days, and that was a wake-up call to him. But people have to realize that this is a potentially serious illness that we have had. What are we up to now? Well over 200,000 deaths in this country. That is likely an undercount, because that's what happens in these situations. And yes, the majority are older people and people with underlying health conditions, but these are people that are, often dying before they need to be. I mean, this is an illness that affects them more, but it's also a roll of the dice. And this is what I just can't understand, why people aren't taking it seriously, because there are people who are very healthy and young and, you know, get it and have really serious outcomes, including some have died. And there have been some really horrible cases of long hauler syndrome, they're calling it, where people just can't seem to recover their previous health. So they have extreme fatigue and they have, you know, difficulties breathing. They have all kinds of issues. So it's not something to mess with. And the insanity of talking about getting a herd immunity is just beyond ridiculous, because that would cost well over 2 million American lives to get that. That's unethical. That is insane to even discuss. That's not okay. Our economy is not going to bounce back until we start dealing with this in a very serious way, like other countries have.
I want to talk about something you mentioned a second ago, which was we're in for a rough 2 months. That includes Thanksgiving, probably the number one next to Christmas, the number one holiday that people get together with family that they don't live with. What do we do? Can we get together safely this year with masks at a big dinner? Or is this the year where we say, all right, see you next year at Thanksgiving?
Unfortunately, this is the year that we all need to think about how to do things differently and safer. You know, obviously we can't do anything to prevent people from gathering, and people will gather. All I can tell you is that a lot of people are going to have really negative outcomes with this. And I can't even imagine having an event where people came to it and then some may get hospitalized or die. I can't even go there. So, I mean, people just need to understand that this is a year that if things cannot be done completely differently, there will be really serious consequences, including, you know, the lagging indicator, which is death. We see the infections, and then weeks or more later, we see the results of that in terms of increased mortality.
So we could have waves. After Thanksgiving, we could see a spike 2 weeks later because people didn't listen to public health and congregated. And then we could have a week or two to breathe, and then people are going to congregate for Christmas or New Year's, and we're going to see another wave in mid-January. So that's what you're talking about, the bumpy few months?
Well, that, and the fact is, so, you know, I always am doing this with my hands. So we started out, you know, about here, and then we had the spike, and then ideally you get back down. So you know, we want to see it like this so that it's just kind of steady and we're keeping up on things and we don't see where the hospitals get overwhelmed. But unfortunately, in the country, especially, you know, in other places too, we're seeing what was the initial bump, and then it went way up, and it's staying up there. So we're starting from a baseline now that's up here, and then it's going to go up. And then we add flu season on top of that, and then we add winter viral season on top of that. So it's going to be a really dangerous time. And in fact, I think it's going to be probably as bad as it was in the spring in a lot of areas. You know, I still have great hope. Champaign County is doing a great job, you know, with what we need to do. But even these little gatherings, we're starting to see that it's just people fatigued with not seeing people they love and getting together or getting with friends and having small dinner parties, small events. You know, we get a case in there and then everybody's infected. So it really does worry us that we would get people together inside, unmasked for events, for any holiday. We're also concerned about Halloween parties, and even though, you know, you're not supposed to have Halloween parties, we know that people unfortunately will. So each time you do that, it's expanding outward. So the people at the party, if there's a case there, or the dinner party or whatever it is, it goes from that. They take it back into their homes, they infect everyone in their homes, and it just keeps going.
I know that it's semantics, but you talk about pandemics usually have two waves. Europe is now on their second wave. They were able to control it after a horrendous spring and early summer. Has America even finished their first wave yet?
You know, it depends. There are certain areas that have had a wave. You know, New York City definitely had a horrible wave, and Chicago and, you know, different places have had a wave, and then it dies down some and then it comes back up. The problem is even if we have had the first and the second wave in some places, it really doesn't matter because we're going to keep having them. And what's happening in the US, which is really concerning, is that, like I said, it's going up. Each wave, instead of being like this, a wave, what we're seeing is like almost like stair steps. It's going up, and we're just seeing more and more and more cases. And this is, always the time that really concerned us because of all the factors we talk about. So people in public health are always concerned going into winter months, late fall and winter months, when you have any type of thing like this going around. So it is, it's scary, and it's scary that what we're seeing is starting from a place of way higher positivity than I think anybody anticipated early on. But we're fighting against basically insanity, magical thinking, pressure not to wear masks, pressure not to do what you need to do. This is something that should not be happening. This should not be happening anywhere. The information is false. It's unethical. And yet we're battling it every single day. And certainly a lot of places way worse than Champaign because for the most part, like I keep saying, Champaign is doing a great job. But, when you get out of here, out of our county, especially, and look around, we're seeing really high positivity rates. And all it takes is people letting their guard down, and we start seeing those numbers shoot up. And again, I always like to remind people of it's a hard concept for people to grasp, but when we're talking about the growth in cases and becoming exponential growth, it's really frightening. And that's how healthcare systems get overwhelmed. And you already see that some places are opening up field hospitals or surge hospitals. It's really early to be doing that.
But is that a good thing? I mean,
that's not a good thing. That they're needing to open them right now. Most places have the capacity to do it. Certainly Champaign County and, Carl SF, we have lots of ability to expand in our community. But the fact that a lot of states and places are having to go to this early in the game is really concerning, because ultimately there is finite resources, there is finite capacity. You can't just start cranking out nurses and this fast to have people to man these facilities, these facilities, people these facilities.
Are you a little relieved that the students, the U of I students, are heading home from Thanksgiving for about 2 months, or are they not even a concern of yours right now because they've done a good job?
The U of I has done an amazing job. I mean, we knew we were going to have a ton of cases there early on if they came back, and we did, and they came back with it. And then they isolated and quarantined. But outside of a few places, they're really, really doing a good job. So, where we're seeing a lot of the spread right now is community spread in our county. It's not the U of I so much. It is just what I said, smaller gatherings or parties. People do weddings, things like that. And you can't really, you just can't control it. If you're going to have these events, it's very difficult, especially if they're inside. It's very, very difficult to do it in such a way that you're going to prevent an outbreak if you have positive people in there. The taking a temperature is not helpful. It just isn't helpful.
I know I'm getting ahead of myself, but when a vaccine is available, does public health get some input on the dissemination of that vaccine and who gets it first? Do you get a say in that?
Well, I can say in normal times, of course. What happens is there's a group that is a national group that looks at not influenza, but immunization practices. So they always make guidelines. So with H1N1, if you remember, it was like initially it was children, young children, pregnant women, people with disabilities. It was people that you always go with who is most at risk. So, and of course, healthcare workers. So in this case, it would probably likely be healthcare workers, but then we will be going the opposite direction. We'll be starting with older people and people with known underlying health conditions. That would be probably where we begin. So it's different, but it's all based on, it's based on the need. Now, Again, I'm saying in normal times because we're not in normal times right now. So I can tell you that in Champaign County, we will absolutely be doing the ethical thing, if at all allowed to do that, unless there's some, bizarre restriction placed on us. But I look for us in Illinois to do it like it needs to be done.
Last question before I let you go. People are quarantine weary now. We're about to be inside a lot more. We're not going to have the luxury of eating outside. Do you have words of advice to keep people just motivated and sane as we're heading into this very uncertain and stressful time?
Well, I wish I did have a magical thing to tell them, but all I can say is that, you're doing a great job in our county. We are, and just, you know, double down on some of the things. We need to all pay attention to where we are kind of letting our guard down, and that's gathering with people, which is obviously a natural thing to do. We just have to continue to be creative and think of ways to engage with each other in different ways through this winter. And I don't doubt that there will be all kinds of creative things that people come up with in our community to share with others, but it just is not safe yet. I wish it was, but the pandemic will end. We just have to, it is wearing. I would be surprised if anyone's sicker of it than me. I'd really be surprised. But yet we just have to, we just have to keep doing it. And I don't care what kind of information you hear, masks are effective. They work. Distancing works. Staying away from others, it works. And it's all we have moving forward. We know a lot. We know now a lot more than we did at the beginning of this, so that we can really focus on the things that matter. And those are the things that matter: distancing and masking. So those will be the things that get us through until this ends.
And wash your hands when possible.
Wash your hands. Wash your hands all the time. That'll save you from all the other icky things going around in the winter too, like the vomiting and diarrhea things that nobody wants, and we don't want you to have them. We're busy enough without collecting poo samples from the entire community, so please continue to wash your hands.
Oh, Julie Pryde, what would we do without you? Thank you so much. I want to thank Urbana Mayor Diane Marlin. She is also partnering with the Public Health Department on keeping her constituents and her family safe. Jason Liggett, we need you. Stay safe. Put yourself in a bubble. Thank you to our wonderful producer, Julie Pryde. Please thank all of your staff on behalf of all 21 counties that you're tracking. Julie Pryde, Champaign-Urbana Public Health District, thank you so much.